It is the only drug approved to treat COVID-19, but Remdesivir is not without its flaws. The changes that UC San Diego researchers believe can make it much more effective.
A former La Mesa officer appears in court facing charges connected to a controversial arrest last year. The evidence being reviewed.
And students at another major local school district return to campus. The district's new focus as it works to create a sense of normalcy.
ABC 10 News at 6 starts now.
It is one of the most important drugs in the fight against COVID-19 and was the very first to be approved as a treatment for the virus last year. Now scientists at UC San Diego believe they have come up with a way to improve Remdesivir. Good evening, I'm Lindsay Pena.
And I'm Steve Atkinson. Our ABC 10 News anchor Derek Stahl is going in depth to explain the drug's flaws and the new formula local researchers invented to address them.
About half of all Americans hospitalized with COVID have gotten Remdesivir. It remains the only drug fully FDA approved to treat the virus, and it's been prescribed to more than 7 million patients worldwide. Studies show Remdesivir helps hospitalized patients recover faster, shortening the average hospital stay from 15 days down to 10. But there have been mixed results on whether the drug actually improves survival rates.
Remdesivir is really a good drug, and it can really help people after they're in the hospital. But most of the mischief the virus does happens before you're in the hospital.
UC San Diego infectious disease expert Dr. Robert Shuley says the biggest problem with Remdesivir is that it has to be given through an IV. Once it's inside the body, the drug works by blocking the virus from making copies of itself.
And by the time you're in the hospital, most of the damage is from the immune response, not the virus. And what we need are oral drugs that you can give before people get into trouble so that they don't end up in the hospital.
In a new paper, Dr. Shuley and other scientists at UC San Diego announced a promising solution. They took a fragment of Remdesivir and tweaked it so it can be given in pill form. And that's not all. In early lab tests, it's up to 8 times more active than the original drug.
We started very early in the beginning of the pandemic. Our chemists came out of retirement to do this.
A team led by UCSD's Dr. Carl Hostetler designed the new formula using a technique they've been honing for more than 2 decades. They essentially took the fragment of Remdesivir and attached a microscopic stick of butter to make it easier for the body to absorb.
Our active compounds require only one step instead of 4.
Their one-step solution lets the drug reach more parts of the body, like the kidneys, that regular Remdesivir has a hard time getting to.
This one step is in virtually every cell in the body, so that any place the virus is, this drug can go. And Remdesivir is a bit more limited.
The pill also appears to last longer. It can circulate within the body for more than 24 hours. Regular Remdesivir is practically gone after just an hour.
Whenever the drug is present, the virus can't replicate. And if the drug gets down to low concentrations, the virus picks up and starts growing again.
Dr. Shuley says the NIH has approved funding for the next round of testing. But to get it to human trials quickly, they'll likely need backing from a large drug company. If they can get it, they're hoping to start clinical trials next year. Derek Stahl, ABC 10 News.
UCSD wouldn't say if the maker of Remdesivir is on board with the investigational drug, and Gilead Sciences declined to comment on the study. But the company did confirm to 10 News it is exploring pill treatments for COVID and said it plans to submit the paperwork needed to start clinical trials by early next year. Also tonight, San Diego County reported nearly 1,500 new COVID cases today. We're also beginning to see an increase in the number of people dying from the virus. 4 more deaths were reported today.
Anyone visiting a patient at UC San Diego health facilities will need proof of full vaccination or a negative COVID test. The health system sent out an email about that new policy today. This only applies to inpatient facilities. Outpatient sites are excluded from that policy for now. Anyone who isn't fully vaccinated will need a negative COVID test no more than 72 hours old and must wear a mask at all times. A grim discovery led to a man's arrest as he tried to re-enter the U.S. this week. His 2 children, ages 1 and 3, were found stabbed to death in Rosarito. Our reporting partners Televisa shared this video from the scene where those children's bodies were discovered. Investigators say the boy and girl checked into a Rosarito hotel with their father on Saturday. They were seen leaving around 2 a.m. yesterday. Then hours later, the dad returned alone. The children's bodies were found by employees of a nearby ranch. The father is in U.S. custody, and state investigators in Mexico say, based off of social media accounts, they believe he is a surf school owner in Santa Barbara. The FBI in Los Angeles is handling the investigation on this side of the border, and police in Santa Barbara just confirmed to us in the last 10 minutes they took a missing persons report on Sunday from a woman who told them her husband and 2 children had disappeared. Our Laura Acevedo is getting some new details on this right now, and we'll have a live report ahead at 7.
In the meantime, the former La Mesa police officer at the center of this controversial arrest video may find out tomorrow if he will stand trial on charges of lying on a police report. Testimony in the preliminary exam of Matthew Dagas just wrapped up. He's charged with filing a false police report in connection with that arrest. It led to days of protests. And our ABC 10 News reporter Rachel Bianco is live in El Cajon, where supporters on both sides showed up in support tonight. Rachel.
Steve, that arrest video was played in court again today. Supporters of the fired officer are confident that this case will be thrown out, while supporters of Amari Johnson say the charges don't go far enough. Former La Mesa police officer Matthew Dagas appeared in court clean-shaven and dressed in a suit. He listened as Detective Julie Jensen testified that Dagas told her he initially stopped Amari Johnson because he thought he was smoking on the Grossmont trolley platform. She says the fired officer also told her Johnson got physical.
He said Mr. Johnson swatted at his hand or pushed his hand.
Body camera and bystander videos capture part of the tense encounter back in May of 2020. Johnson said he was waiting for a friend who lived at the nearby apartment building.
I'm talking to you and you smacked me.
Bro, nobody smacked you, bro. Why I smack you?
You didn't?
Why I smack you?
You didn't hit my arm?
Why I smack you? But why are you grabbing me, though?
Johnson was initially contacted for smoking in public and then told he was arrested for assaulting an officer, but all charges were dropped. Ultimately, the DA charged Dagas with a felony count of filing a false police report. He's accused of making false statements, including that Johnson was smoking and committed fare evasion at the trolley stop. Local activists were in court to show Johnson their support.
The false police report is that he thought he was smoking. He didn't think he was smoking because he had no cigarettes, he had no lighter, he didn't even raise a lit object to his lips. This is a lie.
The encounter happened just days after the murder of George Floyd, leading to local protests. Supporters of the fired officer say the entire case is motivated by politics.
Obviously, 2 days after this George Floyd incident, it's very volatile. I mean, our society, they want to demonize police officers. It's time that we stand up and support our police officers.
Again, testimony will continue tomorrow morning at 9. If the judge decides that this case should go to trial and Dagas is convicted, he could face up to 3 years in prison. Reporting live in El Cajon, Rachel Bianco, ABC 10 News.
Turning now to our weather as we take a live look outside. A flash flood watch is in effect right now in our mountains. Meteorologist Angelica Campos is joining us with more on that. Hi, Angelica.
Hi, Lindsay. When a watch is issued, that means the conditions are prime for the potential for heavy rainfall. When there's a warning, that means it's happening and conditions could be imminent. So just to kind of pinpoint the difference here. So as we look at the next 24 hours, there's a chance for thunderstorms to produce heavy rainfall. Most of everything today has been over the mountains, but it's starting to drift towards the west. As we zoom in closer in our pinpoint Doppler live, you can see there are some areas with heavy rain where the colors are brighter, like those reds or yellows, indicating heavier rainfall. And at times, we've seen the rainfall rates averaging over ½ an inch per hour. That is enough for flooding to occur, and that is why that flash flood watch is in effect through tomorrow. Right now, just north of Julian, or just east of Julian rather, and south of Mount Laguna is where we have those areas of heavy rain right now. We'll see that chance continuing into the evening, and tomorrow we'll have much more in your 7-day forecast.
All right, thanks, Angelica. And you can stay ahead of any rain in your neighborhood with the ABC 10 News app. Find it for free in the App Store.
The newest healthcare market in the Department of Defense was officially unveiled today. It's called the San Diego Market. It is a union of Naval Medical Center San Diego, Naval Hospital Camp Pendleton, along with several clinics and medical homes serving 350,000 local service members. The military says the goal is to create a better standardized system of care.
Make no mistake, today's transformation is moving military medicine into the future. One thing that will not change is our commitment to providing high-quality health care to all our beneficiaries and projecting medical power in support of those we serve.
Military leaders say the San Diego market will also allow caregivers shared access to state-of-the-art medical equipment throughout the clinics and 2 hospitals.
Local contractors say they're not being given an equal opportunity to be involved in Chula Vista's billion-dollar Bayfront development. It's expected to bring 30,000 jobs. 10,000 of those are construction jobs. Our partners at KPBS spoke with the Latin Business Association, which says Latino businesses aren't being given equal opportunity for employment.
The developers from Texas, right? So that's one negative. But even if you're from outside, you still got to include the community where you're building.
The Port of San Diego told KPBS that only a general contractor has been chosen for the project so far, and all other contracts have yet to be awarded.
A former San Diego Padre and San Diego police officer will officially be laid to rest tomorrow, more than a year after he passed away. Dan Walters died in April of last year. Walters started his career as a Major League Baseball player with the Astros before he was traded to the Padres in the 80s. He became a police officer in the 90s. In 2003, he was shot by a domestic violence suspect and then hit by a car. He remained in that wheelchair for the remainder of his life. Funeral services were limited last year because of the pandemic, but there will be an official police procession and memorial service for Walters tomorrow morning.